Welcome to Therapeutic Scraping Essentials, where we discuss all things about scraping therapy as it relates to IASTM and Gua Sha. Today we're going to be giving a talk about myofascia. We're going to attempt to provide a series of visualizations to give a firm understanding from a practical level on how to treat myofascia and why we would use scraping therapy tools for that. During this talk, we're going to avoid too much scientific terms and physiological mechanisms so that we can get straight to the point of how we go ahead and treat myofascia for soft tissue remodeling purposes. But we'd like to refer you to the Therapeutic Scraping Essentials manual, in which there is a chapter entirely dedicated towards the scientific mechanisms and rationale for the treatment purposes of using scraping tools for myofascial release purposes. Now, myofascia is a term that gets tossed around quite frequently throughout the fitness industry, the health and wellness industry, and certainly the rehab industry. Anyone who's a physical therapist, chiropractor, athletic trainer, massage therapist has essentially heard of myofascia and has probably attempted to treat it with various types of products such as foam rollers, massage guns, using their hands, active release techniques, so on and so forth. Through Therapeutic Scraping Essentials, we believe that the best tool for addressing myofascial restrictions is scraping therapy through the use of various tools to examine, scan, detect for soft tissue restrictions within the myofascial layers. So what is myofascia? Myofascia is actually a compound word. So let's break this down. Myo and fascia. Let's just focus in on fascia. Fascia is actually considered to be a membrane covering similar to saran wrap that covers every structure within the body. It compartmentalizes sections off, it wraps around organs, it wraps around muscles and tendons. It's essentially on everything, including nerves, blood vessels. There's fascia around your intestines, there's fascia in your skull and around your brain membranes. And what it allows for is containing a membrane that not only holds everything together, but allows a degree of stretch between various body elements. Not only stretch, but allowing various body elements to slide on each other as well. And it's pretty well commonly understood at this point that when fascia gets bound up, such as this right here, it tends to become knotted or restricted, which we will often refer to as a soft tissue restriction. Just the same as rolling up this saran wrap right here, as that becomes more and more dense, we can palpate and assess whether that fascia or the soft tissue is feeling normal or abnormal, and thereby go ahead and address restoring that through soft tissue remodeling. More specifically, for the purposes of myofascia, now we are taking the concept of myo, which is a term for muscle, and fascia, and putting them together so that we are addressing more specifically muscle fascia. We're going to go ahead and extend that as well to the fascia that covers around tendons and sometimes even ligaments. That's primarily the purposes that we focus on through the Therapeutic Scraping Essentials manual. Now, aside from attending a cadaver lab, which many healthcare professionals have done so through anatomy coursework, there's no better way to get a practical example of just what myofascia is and what it looks like than grabbing a hunk of meat. Looking at this chunk of meat, on the outer portions, we can see what would be considered a lining of skin, let's say. The next layer would be fat or adipose. The red part clearly indicates what is meat or muscle. Now, what's interesting is that while we pull this apart, you can hear a stretch And as we look at that, we can see, here's a great example. This webbing-like material here, it's here, it's kind of spiderweb looking, it's here, and that's our membrane. That is the myofascia layer here. Again, it surrounds the entirety of the muscle in this case, but it's also within the muscle fibers as well. And this fascia is supposed to be able to stretch. You can hear it stretching. Specifically, in the case of using scraping tools, we are attempting to detect restrictions in the fascia layer that tends to feel abnormally hard than what is a normal pliable muscle fascia connection. And thereby, once we find those areas, we use our tool to drag through that. And in this case, you can see right here, I have this fascia. If this was abnormal fascia, we can see our fibers in this case of this meat is aligned nice and evenly up and down, and that's why it's giving us good stretch. But if these fibers were crossed and abnormal, they would not stretch as well, and we would scrape across them in order to smooth those out, and in some cases, literally tear them so that they can now get the stretch that they need. This is important not just for the purposes of stretch, flexibility, and performance, but if myofascia is restricted and tight because they are embedded with pain fibers, nociceptor pain fibers, then they will compress on those pain fibers and cause a painful symptom. A lot of times that can occur in acute injury, but I come to find more frequently this is exactly what's contributing to chronic pain in muscles. Typically we call those trigger points, scar tissue. There's a lot of terms that get kind of invariably used generally for that concept. But again, really it's coming down to understanding that meat is generally pliable. You can see as I'm pulling that apart, you can see these fibers in there, and they need to align a certain way in order for stretch to occur. If we were going to continue to further understand from a practical level just what fascia is and its role in connection with muscle restrictions or soft tissue restrictions, it's often easy to use slime or putty-like toys in order to practice what is palpation and understanding how to feel for abnormal rigidity within soft tissue. So in this case, I have two pieces of putty that are matted together, and let's say that this pinkish area is the muscle layer, and we're going to use this thicker green to represent myofascia. And just like the meat, if we were to pull this, there is a degree of stretch that occurs with this. We can see that stretch, and very similar, you can see fibers that are pulling apart between the green putty. Now, if the fascia was tight and thereby the muscle tight, then that stretch would not occur so readily. It would feel stiff or hard to pull. In addition, if we were to palpate it, which is to say, using our fingertips in order to poke along the body to detect what is normal versus abnormal, then we can feel for these rigidities in the fascial layer and thereby direct our treatments to that. So a good way to bring that into understanding is that every piece of the body has a normal give to it, no different that if I pushed on a pillow, it would give a certain amount. If I pushed on a couch, it would give a certain amount. If I pushed on a wall, it would give less than the softer components. Let's say the wall would be similar to a bone, which we would not expect to have any give to it. Let's say that the couch, which is thicker than a soft pillow, would have a certain amount of give to it, but that a soft pillow would have the most amount of give to it. Regardless, if we are poking through, and once you get in tune with your senses through your fingers, you could certainly come to find that certain areas don't give very well within the soft tissue area. And therefore, you would assume that there's a restriction there, oftentimes called trigger points. And then now we want to go ahead and come up with a source of treatment for that. So let's just go ahead and using this additional, this is actually slime. Within this slime, when softened out or flattened out as this, I can poke through and I can feel that I can sink all the way from the top layer down to what is my hand underneath and feel entire give. Now in this slime though, I went ahead and embedded a plastic toy in there, which would be synonymous in this case with a trigger point that is a soft tissue restriction. And if I was to cover that into the soft tissue lining here, it's not even visible anymore. And if I was to go ahead and palpate through, even without looking, I could come and feel that that does not have as much give to it. It is abnormal soft tissue, and I would thereby deduce that that is a soft tissue restriction that may or may not be useful to treat. Now, soft tissue restrictions are extremely common. Just about everybody has them in all types of different areas of their body, of their muscles and tendons. It's not necessary that you have to treat every soft tissue restriction that you find. In fact, it would probably be impossible. What we want to do is we want to try to be as thorough as possible for relating soft tissue restrictions towards a person's chief complaint of either pain, acute injury, chronic injury, or possible movement performance. So if I took this layer of slime that has our soft tissue restriction in it, and I went ahead and slapped that onto our putty system here, that again, the pink represents muscle, the green represents the fascia that's covering the muscle. If we slap that right on top of there, as if they were supposed to be a unit that slides together with each other and stretches together with each other, well, we could imagine that now that that restriction is in the way, that particular area would not stretch. Again, if we were to palpate, we would feel that it's abnormally hard, which is commonly thought of as a trigger point. And we would want to go ahead and do best to remove that. What we often call in therapeutic scraping, soft tissue remodeling. Now, there are numerous gadgets, devices, products that have long been used and continue to evolve in their use, in which people are trying to do what is called self-myofascia release. So the person themselves treating their own myofascia elements. One of the most common and familiar is the concept of rollers. There are a variety of foam rollers out there. In fact, they are no longer fair to call them foam rollers because there are plastic rollers. There's all kinds of different rollers with vibration mechanisms in them. They heat up, they cool down, they have rigids, so on and so forth. But at the fundamental root of what a roller is trying to do, whether large, small, stick rollers, or whatever the case, it is trying to find that soft tissue restriction, and it is trying to smooth it out. No different than playing with Play-Doh as kids, where we roll it out and we see that that becomes more uniform. And if anyone's ever used a foam roller, you probably can attest to that it is quite painful to roll your own muscles out, especially if you're laying on a foam roller. And those are called trigger points, usually, that you're finding as you scan through your body to find the rigid points and go ahead and work on giving yourself a massage, basically. So rollers were certainly one of the first tools that we used for that. And even before that, there were all types of other things that were essentially just applying direct pressure in order to move that along. Such as lacrosse balls became famous, but you could use a tennis ball, you could use a golf ball. There's all types of little knuckle kind of devices that get used around out there. And these are all, again, trying to follow the same concept that if I had a soft tissue restriction here, again, as seen by here's my fascia, here's a knotted up fascial layer that has, again, this is plastic in here, but that's kind of a good similarity to if you were to palpate along and feel everything squishing and then you got to a hard part, which we're going to call a trigger point in this case, or better yet termed soft tissue restriction, then we would be using an element that's trying to roll that out. So people sometimes use these balls like this, and in our current era, what's becoming increasingly popular is the use of massage guns for myofascial release purposes. Similar to how we just push down with the roller and the ball, we're attempting to find these hard spots. And then now, through pneumatic compression, we'll be using this in order to soften up the area and attempt to remove the soft tissue restriction. So if I was to come up close so you can see this, I'm going to start away from where the marble is here, but as I do this, you can imagine that this would be kind of resurfacing the area and trying to, what we would say, loosen it up. But ultimately, we're trying to minimize or entirely reduce this soft tissue restriction so that it will align better with the myofascia elements and thereby promote better flexibility, less tightness, and certainly less pain if that's what a person was dealing with. So between the products I've already demonstrated here, rollers, massage balls, massage guns, they generally all apply the principle of direct pressure or compression in order to move along soft tissue restrictions. Now, through Therapeutic Scraping Essentials, we would assert that by far a scraping tool is the superior tool or mechanism to promote soft tissue remodeling. Again, as already demonstrated, through direct pressure from these other products, we've probably had an effect to go ahead and soften up an area. But nonetheless, we can see that this rigidity, which is this plastic pink piece in here, is still embedded within the fibers or within the slime of the fascial element here. A scraping tool is going to be much more direct in not only smoothing out areas that seem to be rigid, but also moving that soft tissue right on and out so that the trigger point is remodeled back into circulation. And therefore, with that, again, scraping therapy at face value, before you get into any scientific rationale, seems to make sense to be the best treatment option, certainly more so than direct pressure, whether it's from massage guns or foam rollers, even better than certain advanced therapeutic techniques such as ART, active release techniques, in which someone is finding restrictions but then moving through them in order to release these knots. That is fine and all to go ahead and spin your wheels, so to speak, on that for several sessions at a time. However, I'm going to embed this back in one more time just because it's such a great example of what's going on here. I went ahead and put my mock trigger point back into this fascial bed here. I have my tool, and any scraping tool would do. However, I recommend a thin edge that's between 1 to 3 millimeters. If I come scrape through and I'm feeling for abnormal rigidity, and then I feel it, even without even looking at it, and focus on that area, you can see how it's removing the fascia from it, and eventually it's going to go ahead and just move that right along. So it's kind of a no-brainer, even before you get into all the aspects of physiological mechanisms. Now, those things are certainly important to understand, particularly if you want to be an expert in scraping therapy and understand how to apply that towards all the various muscle and tendon anatomy that can be reached on the body. This is why within the Therapeutic Scraping Essentials manual, instead of just leaving it up to chance and just saying generally apply that technique to the neck or back or wherever, there are 50 case studies that demonstrate specifically where to and how to apply using a tool to scrape through what was previously examined and palpated soft tissue rigidity. Whether it's in the neck, such as the upper trap, which is extremely common, whether it's in the back, or anywhere else along the body. And no different than the demonstration we just gave with the putty, you can certainly feel abnormal rigidity in soft tissue and scrape it along. And with that, just as our soft tissue restriction popped out of the putty, you can imagine if this was stuck in any muscle, the same response would occur, that you could feel it popping free as you do this meticulously and precisely to the anatomy that's involved. Let's continue to look at a few more practical examples using visual aids to better understand how myofascial restrictions can be treated with our scraping therapy tools. For the next example, we're just going to go ahead and look at a common TheraBand here. I like this one because it's red, and pretty much just like muscle, we can appreciate, like muscle, it's supposed to stretch. And it's aligned in various areas on the body to stretch certain directions. Now, if we took this band and we palpate it and said that that's muscle, we would expect for it to have some give with it with our palpation. But if it was knotted up, which is to say, taking this and crimping it, then we would feel that is not congruent in soft tissue normalcy compared to the other areas of the body. This might be easier if we did this. Now, while that's much shorter, of course, but for the purpose of the demonstration, same deal. If I was palpating along here, whether by hands or actually even by tool, I could clearly feel that this would be normal giving tissue, and then I would come to a restriction here. In this case, this is well aligned to what is the flexor bundle of the wrist, in which is a common indicator for chronic pain or even acute pain with regards to tendonitis of the elbow. This happens to be right over the carpal tunnel, and I've certainly treated many carpal tunnel syndromes who were told various things about why they might have numbness tingling to their hand, and it turned out there was a soft tissue restriction right here directly over top of the nerve that goes to the hand. And by scraping that free, within that session, typically, that person immediately was able to restore soft tissue normalcy and thereby decrease the pain signal that was being sent to their hand. This example applies all over the body. If I had an upper trap that was knotted up, whilst there are many different things that people do to try to release that knot, to scrape through that knot, which is hard to do on your own, however, to have a provider do it for you, would be the most quick and effective means to release that knot and restore the natural elasticity and soft tissue normalcy of that area. Now that we've looked at a series of examples with visual aids on myofascia and soft tissue restrictions and how to use our tool to go ahead and thereby treat those restrictions, let's see if we can take a more practical anatomical view of what is going on here. For that, we're going to use our spine model. We're going to recreate a soft tissue restriction or trigger point within the piriformis muscle of the left hip. So we have our sacrum here, and we have our head of the femur, in which anatomically we know that a piriformis sits at an angle very much like this. It begins on the anterior margin of the sacrum here, and it moves at an angle towards the femur, attaching to the back end of the greater trochanter. All of this is referenced within the Therapeutic Scraping Essentials manual, by the way. Nonetheless, we can go ahead and imagine here, when a person has a knot in their butt, which is extremely common, they do things like sit on foam rollers, have a massage therapist push on it, they do stretches such as the figure 4 stretch, so on and so forth. What we want to do here is see if we can be a little bit more direct and precise with the treatment option, in which, just as before, here's our little soft tissue restriction. I'm going to go ahead and hide that within the TheraBand. And so now I cannot even see it. But if I was to palpate along through someone's gluteal region, I would eventually be able to find what feels like abnormal soft tissue, being that it's rigid and relatively less pliable. And now I would know that if they had a chief complaint in this area, I might want to direct a treatment to that. In which case, I would take my scraping tool and I would directly go in line with the fibers of this muscle until, watch this, it's going to pop right out. It popped out. Now, it doesn't necessarily pop out in 3 strokes such as that. However, with persistence, you would certainly detect through reassessing and palpating after delivering your treatment that would feel like it's less rigid and potentially associated with the recipient getting up after the treatment and noting that there is less pain in that area. Now, that's particularly important. Not only is there common to have a knot in the piriformis, but the piriformis is also many times implicated with sciatica. Now, there's 2 forms of sciatica, what I like to call true sciatica and pseudo sciatica. Now, true sciatica is not necessarily as effective with therapeutic scraping. It may help to relieve symptoms, however, they tend to be coming back because true sciatica is related to, I'm going to go ahead and pass this underneath the TheraBand of the piriformis to mimic, this being the sciatic nerve here, which passes underneath the piriformis and further goes down the posterior aspect of the leg. This sciatic nerve conjoins with the nerve roots that are coming out of the spine here. And we know that true sciatica is an issue where the neurological symptom of numbness, tingling, shooting pain down the backside of the leg is a result of a disc hitting a nerve and zapping a signal down the leg. Again, if you're advanced, you are capable of helping to relieve symptoms associated with true sciatica, but until that disc bulge is reduced one way or the other, typically that signal is going to get fired again. In consideration of that, with pseudo-sciatica, we may not have as much disc involvement and we just have a knotted up butt muscle, in which case that knot, here's our knot again, embedded directly on the piriformis muscle is going to crimp. Again, this is our sciatic nerve. It's going to crimp on the sciatic nerve. And anytime a nerve gets entrapped, it causes what is called a radiculopathy, which is a sensation of burning, numbness, tingling, shooting pain to the distribution of where that nerve is, in the case of the sciatic nerve, and the posterior lateral aspect of the lower extremity. Nonetheless, in the same example, if I was to go ahead and scrape through my piriformis, here we'll even embed this back into the band. So now I can't even see it, but I could feel where there's normal tissue and rigid tissue. In this case, I would deduce that that rigid tissue is directly on someone's sciatic nerve. If they're telling me that they're having an issue with these types of symptoms, I could scrape along that to go ahead and decrease the tension in the muscle itself and hopefully direct my treatment on the trigger point to pop it out and then now restore the normal soft tissue there. Along with that, the scraping therapy is not necessarily conclusive to itself. You would want to go ahead and back that up with the other treatments that we often use for these types of things, such as stretching the piriformis muscle with the figure 4 type of stretch. But you can imagine that now that that tool has been taken to that area, that muscle would be more likely to stretch with your backup therapeutic exercises more so than if it was knotted up. And that applies to anywhere in the body. So what I like to say is that if a person is having a soft tissue restriction and thereby doing stretches to assist with that, if their soft tissue is abnormal, then that's a lot like trying to pull a muscle through tar, in which is going to be very sticky and slow going and possibly take, as we know, weeks, months for that to reduce, versus being able to scrape that, get it to go as straight as possible, and immediately stretching at that point. Again, with that practical example in mind, we can assume that therapeutic scraping is flat out superior to the majority of other treatments that are used for this type of thing, whether it's a massage gun, a foam roller to someone's butt, or even active release techniques, which is pressure with movement underneath it. So while this example essentially showed how to scrape a piriformis muscle, we can refer to the Therapeutic Scraping Essentials manual here, in which we can look up piriformis. We can find it in two ways. If we go to the table of contents, we know that the piriformis is included in the lower extremity. So we would go to the lower extremity procedures on 216. Once we were on 216, we would see a list of the other anatomical structures that can be accessed with scraping tools, in which case piriformis has its own demonstration and procedure on page 240. We could also find piriformis by going to the back of the book in its index and flipping towards P, in which, as we scan, we could find piriformis is listed on page 240, where it discusses piriformis syndrome. What's also great about this index is that, let's say you did not know what a piriformis was, but you knew that someone was having posterior lateral hip pain. With that, you can go ahead and turn in the index to H for hip, in which case you could scan down and find hip pain, where it is divided into structures that are in the anterior hip, lateral hip, medial hip, and posterior hip. In this case, because piriformis is more situated on the posterior hip, one could go ahead and find page numbers of muscles that are on the posterior hip, in which in this case there are 3, of which one of them is page 240, the piriformis. Now that we've had a look at how we can access the scraping procedure demonstration, let's go ahead and turn to page 240. So now on 240, we have our piriformis therapeutic scraping procedure. I'm going to send this a little bit closely so you can see. We have a description objectively of the piriformis, and on this side we have the therapeutic scraping procedure for piriformis, which is given in sequential steps in order to best treat this, along with illustrations for how to set up a recipient in best position for accessing the piriformis. So it's pretty well demonstrated on what you would want to do here. We have our piriformis with anatomical sites at the sacrum, along the anterior lateral surface, and its distal attachment is at the femur, along the superior border of the greater trochanter. It discusses muscle action, such as assisting with external rotation of the hip. It discusses assessment findings, such as pain with palpation of buttock trigger points. And it provides a description of injury syndromes that tend to be associated with, in this case, the piriformis. In each of the 50 other demonstrations are laid out the same exact way. And we can see here, very similar to the demonstration we just showed with the TheraBand along the spine model, that this line, this therapeutic scraping mark, shows a flushing pattern that is exactly at the same angle as a piriformis. So it is very well precise in the ability to detect soft tissue restrictions within that myofascia element, and thereby treat it and reduce the painful symptoms and trigger points associated in there. Each step here is going to correspond to each picture. So step 1 goes with picture 1, step 2 goes with picture 2, step 3 goes with picture 3, explaining exactly how to scrape that muscle. These tips, they discuss a few guidelines for how to set a person up, how to properly drape them, and discusses the appropriate follow-up stretches that might be used for treating a particular area. Let's go ahead and take a look at a few more anatomical examples of how therapeutic scraping assists with restoring or soft tissue remodeling of abnormal myofascia. We're going to go ahead and use the spine model again for demonstration purposes. In this case, we're going to do a hip flexor restriction. So, hip flexor, which is a general term, we're going to break this down a little bit more specifically to iliopsoas, which we can break down even more so to the iliacus muscle or the psoas major muscle. These muscles originate on the front of the pelvis and spine as such, and they come down to insert at the lesser trochanter, inner margin of the femur here. And so a hip flexor, when it activates, is supposed to flex the hip like this, which we know, just as I'm sitting, can lead to tightness as far as just staying in one static position. But for those who actively engage their hip a lot, like runners or cyclists, this hip flexor tends to get pretty tight, and thereby, just like any other muscle, develop its soft tissue restrictions. The worst, of course, being when a knot or nodule forms in this area that causes what seems like growing pain. So, there's our hip flexor. In this case, because we're holding it on the inner portion of the ilium here, this is our iliacus. But we know that the psoas comes down and blends in with it, and they both conjoin to come to the femur here. And typically a person's pain with a hip flexor and their soft tissue restriction actually tends to be in this line, which is considered the inguinal line or your underwear line. It is not uncommon for therapists who know to do things like active release techniques, in which case this is typically done when a person is laying supine on their back. But if we had our soft tissue restriction here again, embedded within the myofascial elements, that one would come and palpate along that muscle to find the restriction and thereby push in with their fingertips. So now that we palpated it and scanned or assessed the normalcy of the soft tissue, we found an abnormal rigidity. So we're going to direct a treatment at it through direct pressure with our fingertips. So in the case of active release technique, usually what happens is the person is told to flex their hip in order to shorten that muscle, while as the therapist will push straight in, and then the person elongates through that, and it's a series of motions in trying to push the trigger point out of that area. I can tell you it's a slow going process, and I've never seen anybody have that done and in that session itself just stand up and say the thing is gone. In addition, usually hip flexor stretches are assigned with that and all types of other corrective exercises to restore the balance or address the muscle imbalances of the lumbopelvic hip complex. While all that stuff is certainly important to address, in the more immediate sense of things, before all that's even done, even release techniques, exercises, so on and so forth, if I was to go ahead and want to apply therapeutic scraping to this, in which case my tool would come along and feel for the rigidities, focus on scraping through those rigidities, scan and assess for soft tissue restrictions through palpation using the tool. So now that I've gone ahead and smoothed that muscle out, I would be much more successful at applying active release techniques or any type of stretching techniques to get that muscle to stretch without the restriction embedded in there. And done right, you typically get an immediate result with that. While this is simply a model and an example of what is going on here, what we can appreciate is that this line of the hip flexor is very much represented in our Therapeutic Scraping Essentials manual. In which case, if I needed to address how to scrape that muscle and wanted to learn how to do that, I would go to my table of contents, hip flexors in the lower extremity, which is on 216, is where low extremity procedures start. Upon reaching 216, scanning through the list of anatomical sources here, hip flexors are on page 234. Upon reaching 234, I have the objective information for the hip flexors listed as iliacus, the psoas, even the tensor fasciae latae. This provides the objective information of anatomical references and muscle actions and gives a description of assessment and overall injury syndromes that are associated with hip flexors. And on this side, we have the actual therapeutic scraping procedure, which is listed in concise steps, with each step corresponding to a picture, and each picture very much showing the line of the hip flexor lighting up or receiving a therapeutic scraping mark because of its indication for treatment. So very similar to the red TheraBand that we used on the spine model, we can see that the book directly follows concisely with actual anatomical references. And because these steps are laid out very concisely and objectively with the anatomical information, this pretty much entirely describes a therapeutic scraping procedure with little variation or room for going astray or moving outside of the boundaries of what is being described here. The anatomy will never change. The steps are listed in relationship to the anatomy, which means that it directly speaks towards it, such as scrape the proximal psoas with strokes directed at an anterior lateral angle near the edges of the abdomen. Apply scraping of the iliacus by maneuvering along lateral and anterior inner rim of the ilium, so on and so forth. So it is not using general terms here, it is referencing towards your anatomical sites to be as precise and concise as possible for directing your therapeutic scraping procedures there. In this case, because the hip flexors is a muscle group of 3, but actually 4 muscles going on here: iliacus, the psoas major minor complex, the tensor fascia lata, and the 4th being rectus femoris. However, the rectus femoris in this particular manual is grouped in a different section on its own. Nonetheless, there are several illustrations to paint the best picture of how to go about treating a hip flexor complex. So as shown, the rationale and treatment philosophy behind soft tissue remodeling through therapeutic scraping, it can be applied to any muscle or tendon on the body, particularly directed towards myofascia and other soft tissue elements. Let's do one more working example. Once again, using our band and our spine model. Let's do a quadratus lumborum, often called the QL muscle. Is a muscle that situates itself like this. It's on the inner rim of the ilium, and it goes to the transverse processes, or basically the side of the spine. And thereby, when it pulls tight, it makes a spine side bend. And if a person has pain in what is a posterior lateral angle, oftentimes you'll palpate in that angle and you will find a soft tissue restriction in that region. Best to do that palpation in side line for the individual, in which the involved side is top line. If we took our soft tissue restriction and embedded it in the fiber again, similar to other things we've already talked about, it would not be uncommon for someone to try to stretch that area, push directly on it and try some ART, maybe put a cup on there, so on and so forth. A needle from an acupuncturist, you name it, JT tape. At any rate, the more direct, effective way to do this is going to be to put that person in sideline and then go ahead and scrape through the fibers, through the soft tissue restriction, until the palpable abnormal rigidity smooths itself out and pops along. And that will be immediately detected within that treatment session. Done right, you will have a significant impact on the normalcy of that soft tissue so that it stretches better. And now when we put that person in sideline and we drop their leg off the table, we can pull that apart and thereby restore the flexibility in that muscle. And typically, done right, that person will get up and immediately feel better. But what's also really awesome is treating a QL is actually very objectively measurable with regards to using a goniometer and measuring lumbar lateral flexion. If I took my goniometer and aligned it at the proximate to L5S1, side bending lateral flexion. If a person leans that way, then my goniometer is going to swing from its 0 line, and it's supposed to go to approximately 40 to 45 degrees here. Both ways. Which is to say, the spine can be measured to move over as such. So, if a person had a type QL, not only would they typically be describing pain in this area, and not only would a good therapists be able to palpate the feel for that pain in that muscle there. Again, this is mimicking a QL muscle that's on the posterior lateral angle of the ilium or iliac crest going towards the transverse process of the spine. So this is a left QL, and if it was to stretch properly, it would need to stretch while the person goes into right side bending. And if it had a knot on it, when we ask the person to bend to the right, we would find that they would be restricted in that motion. And a lot of times I find that it can be as much as they're only going 15 degrees or 20 degrees to the side, just like that, as opposed to going all the way to 40 smoothly. So we can now objectively quantify our treatment approach here, because once we go ahead and scrape properly through that region, assuming that was done properly, now that that muscle doesn't have as much soft tissue restriction, we go ahead and we measure that again. And we say, go ahead and give us right side bending or lumbar lateral flexion towards the right to assess the stretch of the left QL. We would tend to find that that stretches all the way. Now that's pretty fascinating, considering that many other disciplines of providers, healthcare professionals, fitness people, chiropractors, you name it, would somehow assume that that inability to bend to the right is coming from muscle imbalances, joint restrictions, yada yada, you name it, that is going to take a series of treatments over time to restore and fix, and certainly to get some pain relief out of that. Of which most people would say that, yeah, it took them 2 times a week for 6 weeks, or the chiropractor wanted to see them for 20 visits. And I'll take the Pepsi challenge on that any day, because one good session will go ahead and restore that, and a person will bend all the way over to the side and typically report right then and there a decreased threshold on the 0 to 10 pain scale. Again, this type of process, treatment philosophy, principle, whatever you may call it, applies anywhere in the body. This QL right here is very similar to, you can imagine if a head was on this, someone's scaling muscles and upper trap muscles, in which case they might be reporting a lot of pain in the side to the upper portion of the neck here. And again, I could go ahead and measure their side bending and find that it's not going as far as it should be. In this case, again, it would be about 45 degrees. I'd palpate and I'd find soft tissue rigidity or abnormality. I would typically put that person in side lying. I don't really treat the neck sitting up unless I have to, because I like for them to be passive, and it also helps me to do not only the treatment in regards to scraping through the neck along the direction of the fibers to reduce that soft tissue restriction that's being felt, of which case, once I feel that it's reduced, in addition to once I derive the therapeutic scraping mark, which is the indicated factor for microcirculation, now that they're in side lying, it's very easy to grab them and pull them this way while pushing this end that way, which is typically, you pull on the shoulder to do that, while taking the head the other way, and we can see how that's clearly stretching them. Once that person stands back up, we would go ahead and measure again and find typically that they go closer to the 40, 45 degree mark, restoring the full soft tissue element there. So there you have it. We hope you've been thoroughly informed and positively convinced that therapeutic scraping is an essential tool for soft tissue remodeling purposes, for providing pain relief and recovering from acute and chronic injuries. We encourage you to look further within the manual, Therapeutic Scraping Essentials, for more in-depth discussions and lecture material describing the principal mechanisms and physiological responses associated with applying therapeutic scraping. We certainly look forward to bringing forth more discussions and demonstrations of therapeutic scraping procedures so that you can better direct your treatment options for providing satisfactory results to those in need. Thanks for sharing your time with us at Therapeutic Scraping Essentials.